Well, good afternoon, everyone. Or I should say good afternoon, almost noon, everyone. I am Mark Giordano, your CEO, and I'm so happy to see all of your lovely faces this afternoon. I want to first off by really thanking each of you for being with us today. As you know, we recently moved our meeting to an every other week cycle. And as a result, we did that as a result of information coming in and new information being available at a much slower pace than what we had experienced early on in the pandemic. So we know you're all super busy, and we want to make sure that as we meet with you on a regular basis, that we have robust information for us to share with you during this call. So we're meeting every other week, and we're going to continue to assess the frequency of the meeting as we move forward, and we will adjust the frequency as the need arises in the upcoming months, weeks or months. So as we continue down this path, we are seeing a significant growth in COVID-19 cases across the country in many of the states that we're operating in. And I know that feelings of predictable nature of where we are right now as it relates to COVID. The setbacks can feel scary, and obviously are testing our endurance, our level of endurance and stick-to-itiveness with all that we are working with. Can everyone hear me all right? Can everyone hear me? It's a little choppy. I'm seeing some of the comments. You can't hear me?
You're going in and out. You're going in and out, Marco.
All right. Okay. Let me know if it gets better or if it's still the same. Is it still the same?
It's better now.
It's better? All right. All right. So I can see you, June. So June, you keep on giving me a thumbs up, and if it gets choppy, let me know. And then I'll have to switch to another way of communicating.
Hey, Marco, how about after this call, we talk about...
Now it's bad again.
Yeah.
Wow. All right. So, so with that said, I'm gonna try to talk and switch to... Go ahead, Brian. Brian?
Sean, is there someone else on the agenda? Maybe we can kind of advance the agenda a little bit while Marco switches over.
There we go.
You're on mute, I think, Sean. We can't hear you. We can't hear you, Sean. Is your press the button on your headphones? No.
That's okay, Alicia, I got it. Christy, let's jump to you in the agenda. We'll do helping hands first, and then Marco, we'll come back to your opening.
All right. Hi, everybody. Can you hear me? Excellent. Yelena, we can all hear you. All right. That was amazing. I am so desperate to know what Yelena just said, although it's none of our beeswax. So hi, everybody. Welcome to the town hall. I'm happy everyone's here. And I think part of what Marco was about to say is we're in it another week. And thank you for everyone for your patience, your input, and everything that you're doing to make this seamless for our participants, for ourselves, for our coworkers. It's tough, 4 months, and I'm feeling a different type of stress from people. Before it was, what will it be like at home? And then it was, what will the summer be like? And now we're missing the summer because we're already projecting into what will September be like. And so if I can just ask everyone for just a moment to be in the moment, and this very moment, we're okay. It might not be great and it might not feel good. It might even feel lousy, but it's just okay. And in this very moment, sometimes okay is okay. And maybe you're smiling because you're thinking, no, I'm having a great moment. And so good. Please share that moment, share your thoughts with your coworkers, because some people really are struggling, and encourage them to reach out. And so the reason why I wanted to take a minute today is to remind everybody, with the new fiscal year, we start July 1, anyone who was seeing someone through Helping Hands needs to reach out to me, give me a call or an email, and just to let me know that you want to start again, so I could get you going, get a new client number out to the providers. And let's keep seeing people, let's keep talking, let's reach out for help. And when you see someone or hear someone who needs a little something, send me a line. You don't have to say too much, and I won't even reference you, but it's important that we look out for each other right now, and just take care of ourselves. I don't really have anything else. Please reach out, and I think it looks like Marco said he's back. Let's see. All right, bye everybody.
All right, so does this sound a little better? Can you guys hear me?
Marco, you're not really back yet.
Really? I'm not back. Take it away, Tara.
Shayna, do you want to do opening updates? And everybody, we apologize. We're having a lot of technical difficulties today. I know our regular host is having some technical difficulties. Marco's experienced them as well. So please bear with us. We'll try to get you the information as best we can. Shayna, are you ready with opening?
Sure, no problem. Good afternoon, everyone. So there aren't any specific updates today regarding returning to the workplace planning. However, I do have a few reminders around returning to workspaces and plans. So as states and counties continue to move through their reopening phases, some even backwards with the recent spikes of COVID throughout the US, our number one priority and focus to plan around what's best for our workspaces, employees, and community remains the same. We still anticipate a phased-in approach to returning people to the workplace, while also providing 2 weeks to 30 days advance notice for returning people to their workspaces. With regards to the readiness assessments, if you have not done so already, please complete and submit to your divisional or your executive department lead so that we can review them. The council has reviewed many return to workplace plans so far, and there is one thing worth mentioning that pertains to COVID testing and expectations. So according to the CDC, anyone who has been in contact with someone who has COVID should take steps to quarantine for 14 days symptom-free after your last contact with the person who has COVID. So even if you test negative for COVID-19 or feel healthy, you should still quarantine since symptoms may appear 2 to 14 days after exposure to the virus. So we just want to make sure that when you're writing your plans and when you're putting them together, that we're not notating anything that says RHD is requiring, recommending, or suggesting anything related to COVID testing. As always, if you guys have any questions related to returning to the workplace plans, please direct them to your divisional and or your departmental leadership team members. And I will pass it back to Tara.
Shayna, before you go off, some folks in the chat were asking to repeat the days of notice that we are committed to giving staff.
Sure. So we are committed to giving 2 weeks to 30 days notice. So anywhere, the minimum would be 2 weeks, the max, or around at least 30 days. Yeah, at least 2 weeks, sorry.
Thanks, Sheena. Linda, are you ready? You're up next.
Yep. Hi, everyone. I'm Linda Donovan, Chief Program Officer for Behavioral Health and Housing. I just wanted to go over today the visitor protocols and first really emphasize before we talk about visitors that all of the basic COVID protocols are in place that you received in early April with some small updates around visitors, and that until a program has gotten the green light to reopen or change their practice, we are still in a no visitor kind of situation. Once your program has gone through, done their assessment, and the assessment is turned into a plan, and a decision is made on a date to reopen, in partnership with the program and the division leadership and risk management if necessary, a visitor plan can be introduced. So I wanted to just emphasize it again. This is not saying we are now open to visitors. There is not a one size fits all, but when your particular program is ready for visitors, there is a document that was made around best practices around visiting with risk management and participation from people from IDD and behavioral health around what would be best practices for visitors. It includes things like having a designated area, limiting the number of people, the amount of time, have visitors call the site prior just to make sure that nothing has changed at the unit. Because what we want to remember is that things can change quickly. In a site that has been relatively healthy, there could be somebody with symptoms, there could be some condition where we want to change our practice again. So just wanted to make sure that everybody knows that we, until your program is given a green light, no visitors is what we are still following. Once down the road, when a date is determined, there are best practices that are available for each program to look at and work in conjunction with their leadership to establish visitors protocols and best practice.
And I'll just add in, Linda, to you. We still want to ask those same questions that we're asking our employees when they come to work. Where have you been? Did you travel anywhere? That's really important right now, and I'll go into my piece later about the states and the hotspots. But we really want to protect the staff and the participants and our community at large from increasing the spread. So you just want to take the temperatures, answer those questions, and then obviously wear the mask and social distance and keep washing the hands.
And as June said, all of that is in the original protocol document that covers a wide range of topics. So just to refresh that again, and now I'm going to turn it back to June for the rest. Thanks, June.
There we go. I was on mute, sorry. Thanks, Linda. So good afternoon. I'm June Hodges, Director of Risk Management. I've been asked to share our COVID statistics this morning or this afternoon, and also speak a bit about the rising cases across the United States that Marco alluded to earlier, and how that quarantine situations may impact our programs. Currently at RHD, we've been lucky due to all the hard work of our community members. So round of applause there. We've managed to experience decreases from week to week in COVID-19 positive cases and incidents under investigation. Specifically in July, we've seen a reduction in the number of reports submitted, receiving only 10 last week, with 2 being confirmed cases and 8 still possible or suspected. Our consolidated data is as follows. Since March, we've had 703 reports. 260 have been confirmed cases. 350 have been negative. 48 are still under suspected status, and 45 possible exposures. We continue updating the statuses of the suspected and possible cases, and we've made significant progress over the last week. A big thank you to everyone in responding with follow-up reports. So as you know, each day we hear about the uptick in cases across the country. Increases are dramatic and attributed to states not enforcing safe practices in the beginning and early reopenings from Memorial Day to date. Now those states are seeing the results of those plans. The following states are currently considered hotspots, and I just want to impress upon you what states they are because it's important. Alaska, Alabama, Arizona, Arkansas, California, Delaware, Florida, Georgia, Iowa, Idaho, Kansas, Louisiana, Mississippi, Nevada, North Carolina, Oklahoma, South Carolina, Tennessee, Texas, and Utah. Other states are now enforcing quarantines themselves on visitors and those people returning back to their home states. Quarantines of up to 14 days or testing with negative test results within 72 hours of arrival are now the norm. And that's so you can enter the state. Some states are even requiring second and third tests over a week's time to ensure accurate and confirmed detection of COVID-19. The goal here is to minimize the spread. What does that mean for our programs, RHD, and those employees coming to work each day or persons visiting? We need to not only be vigilant about our protocols, some of those we just discussed, for programs operated in any of those states I just mentioned, but also to make sure we're asking the questions of staff, clients, and visitors every day as they enter our programs elsewhere. Have you traveled recently? Where? Have you been around anyone who has traveled? And so forth. If anyone answers yes, they cannot be admitted to the program until they fulfill the quarantine requirements or provide accurate negative test results within 72 hours. Be sure to check your state's requirements, and there is a link on the CDC's website under the travel section. I urge you all to continue to adhere to our visitor and employee protocols, as these measures will enable RHD keep its clients and staff and communities safe during this pandemic. Thank you, everyone. And now Sean Mott will continue with our town hall program.
Hey, thanks, June. I'm going to pass it to Sarah to do some housekeeping real quick, and then we're going to do some Q&A.
Hi, everyone. So I just wanted to remind folks of the different ways that you can submit questions for the Q&A today. The first is through your voice, which is our anonymous suggestion box. The second is our COVID-19 email, which is RHD_COVID_19@rhd.org. You can submit questions in the chat, which is in Zoom. And you can also raise your hand through the Zoom feature at the bottom, which I believe is in the participant panel. And then we will take your questions as we get them. That is all for me. Sean, do you want to jump in if you're able?
Thanks, Sarah. Sean is unable to join us yet. He is listening, but he's unable to speak still. So we're going to go ahead and start the Q&A now. Like Sarah said, if anybody has any questions and you would like to ask them live, please raise your hand in the participants panel. And we will also be taking the chat room questions. Right now, I see that we do have one question in the chat group, and that is for Linda, I believe. Linda, is approval through the council needed for opening a program to visitors?
So there have been some programs that many programs that have never closed down, but have been closed to visitors. I do know in different states, different counties, they've gone from yellow to green, and there was questions and expectations about having visitors. What I would say is that those programs have remained open. So it's not, they may not have had a time to run through the council to get the green light because they didn't cease operations. However, any change in visitors really needs to be done in collaboration with the leadership of the program, the division, and risk management. And I would just maybe ask Shana if there was anything that I, forgot or anything else that she wanted to add to that too.
Oh, you said it just fine.
Okay.
Can I just share that I want everybody to kind of understand that the visitor protocol is separate from the reopening process. So when you get your okay that you're reopening, which does go through the council, that doesn't change your visitor protocol. And so for programs that have been open and programs that are newly opening, as well as administrative offices, we want to just remember that the visitor protocols are still in place until they are specifically changed. Hopefully that wasn't confusing, but just kind of think of reopening. You're reopening under all of the conditions. Your reopen is under all of the conditions as indicated both in your reopening plan, but also as per the information and documentation, warnings, all of the things that June shared with you about visitors. So right now we are still in a essential visitors only posture. And if someone is an essential visitor and must come onto the property, you're going to go through that list that June was just kind enough to share with us. And if there are additional questions, I hope you'll let us answer those, but I just want to kind of make that distinction for everyone.
Great, thank you both.
I also wanted to add one thing. We've had this question come up in the last couple of days, is that, well, if the person had traveled to any of those states, but they're fine, they don't show any symptoms, can they still work? And I said, absolutely not. They need to follow the protocols, either 14 days quarantine or get the test and make sure it's within 72 hours that you relay what the results are.
Thank you all. Sarah, I believe you have the next question from your voice.
I do. This is a question around reopening. It appears there's a lot of inconsistencies in determining which programs are ready to reopen. Why are there so many inconsistencies, specifically regarding the number of thermometers and PPE?
Okay, so I can take this one. I'm not really sure specifically what those inconsistencies are or what concerns the program is raising. What has been kind of standard is making sure that programs have no contact thermometers before actually setting a date to reopen, and having a backup, making sure that they have enough for however many entry points that will be used at that site for people to come in. And in terms of PPE, we have definitely communicated, I think Sandy has communicated as well, really to plan around having 3 months supply of PPE. How that number is achieved, we've kind of worked with programs, we've shared calculators, we've even kind of come up with some numbers when we're doing, not come up with numbers, but we've come up with a way to calculate that number and what it would look like for PPE for that program. But it really is dependent on the program, the need of what types of PPE you need in order to do the job at that site, not just that program. But that would be what's considered from the divisional review down to the council review when we're talking about no contact thermometers along with PPE in general. I don't know if that helps.
Can I add one other thing,
With
Shayna?
the spike in, I'm sorry.
Go ahead.
With the spike in the various states that June just named, we would be interested in knowing if you're having difficulty in getting the PPE that you need. So if these various states could please keep us posted, that would be great.
I just also wanted to add to the answer to that last question about the inconsistencies. I'm not sure I would describe it as inconsistent, because as Shayna indicated, the methodology that we use to determine whether or not a program is open is consistent. What does not follow through, and which I guess could be perceived as inconsistent, is what it takes to open. So what it will take for your program or office to open depends on a bunch of factors. How many people are in that space, what the status of the area you're in is, what your PPE supplies are, how many PPE supplies you need depends on all of those things, including the vulnerability of consumers you serve. If you serve consumers, it will depend on how many people, how many days a week you're open, the hours you operate, the number of people that need to be in the facility at any one time. So it really is, if you were just kind of looking at this program getting a yes and another program getting a no, I can completely understand why it looks like it's just all over the place, because it is extremely tailored based on geography and all of those other factors I just named to the specific needs of the safety for the staff and consumers that are working in that space.
Also considering that, you know, the hotspots and COVID doubling back and all of those things could make it look inconsistent, but we have to err on the side of safety. So it may have been one state was very close to opening and then all of a sudden you have a spike and that changes things. So it could look inconsistent based on that as well. But keep in mind, this is a process that is ebbs and flows. So that might be why it looks inconsistent.
Thank you, everybody. Our next question, June, it looks like you may have answered this in the chat, but I'm going to ask it again because I think it's important for everybody to hear this. We have many employees who live in one state and work in another. Many of those states are on the quarantine list today, and people are coming into states that are not on the quarantine list to work. Can you help people understand how that impacts them?
Sure. Essential workers, and we've been deemed those people who work at our programs are considered essential workers, can travel from one state to the next. Obviously, they need to be really cautious about their protocols and following masking, washing hands, etc. You know, check their temperature and note if there's any elevated temperature, they should not come to work. We just want them to be vigilant, again, about the COVID protocols when they're coming in and out of Delaware or a surrounding state that is on the list.
The expectation is, everyone, for the states that have, or for everyone that works in dual or tri-state areas, is that when you're traveling, and I just want to put this in there for the safety of everyone, when you're traveling, I see there's an example from Elizabeth about working in Delaware, coming to Philadelphia. The assumption is that in that traveling, whichever state has the prohibition, you are not in that hotspot state out at the store and stopping on the way. That's not where you get your Wawa coffee break, or just
not at the beach.
Starbucks coffee break. You're not living there and hanging out at the beach, as June said. So the hope is that for individuals who are essential workers, and we know that that means you're probably working hard, that you are going directly from the one state to the other state without making a detour.
Thanks, Stephanie and June. Alicia, I think our next question is for you. And the question is, what happens if a staff member contracts COVID following reopening and has no banked sick time?
That we've already advanced the sick time, as we indicated at the very beginning of this. So we have some other resources that have been made available. I think through the employee resources, people can apply for the sick time available to the bank. They would need to be out on COVID sick. If they are FMLA eligible, they would apply for FMLA through the benefits department as they would in any other situation. If they are not, then they are out and they can't return to work, but they are absent without pay, or they can apply for sick time available to the bank if they have used, I just want to make sure everybody's paying attention. If they have used all of their time that they have earned already, as well as what we have agreed at the beginning of COVID and the shutdown to advance. We agreed to advance everyone what their accrual would be through December of this year, of 2020, through the PTO calendar year, which ends on December 26th. We agreed to advance that to them. So they've used all of that time. If they have no time available, they have access to the PTO bank that I believe Baroness has spoken about quite frequently on this call, and maybe there's some new people they don't know about that. Go to the COVID website. But it is time off without pay if they don't have that. I hope that answers the question.
Great, thanks, Alicia. This person has a multi-part question. Actually, Alicia, this next part is not for you. June, I think it is for you though. And the question is, what is the RHD procedure for quarantine following a positive test result for the rest of the staff and participants of the program?
Sorry, had to unmute. Okay, yeah, so anybody who's been exposed to that person must quarantine. They can get tested, is an option. It's not mandated. Obviously, if they get tested and they have a negative result within the 72 hours, they may come back to work, just as long as they produce the test result document.
Thanks, June. And then the follow-up question she has to that is, would that mean the entire group would need to quarantine? And how would that impact the staff that would be sent home to do so?
Okay, well, yeah, if there are 6 people that were exposed, then all 6 people have to quarantine. That would mean that they cannot work until they get tested and have a negative test result within a 72-hour period, or fulfill the 14 days. And so other staff must come in and relieve them who do not have COVID or who were not exposed to COVID.
Thanks, June. Sarah, I have no other questions at this time. Do you have any?
No, I don't.
Great, thank you. I'm laughing because we were just going to go to Marco and I just watched him walk off the screen. Oh, there, he's back. Never mind. I just want to say thank you to everybody for bearing with us today. Today's call has been an adventure. I'm not really sure why. I'm hoping next time it is not so much fun. Marco, let's see if you can give closing remarks now.
All right, how's that sound? Does that sound better? Perfect. I'm right by my router, so hopefully it won't be a challenge. If it's a challenge, Baroness will step in, so feel free to talk over me, Baroness, if you need to. So I am thankful for all that participated on this call today. As you are all hearing, we are still in the depths of COVID-19 and really needing to be continue to be cautious around what we're doing, how we're doing it, and continuing to follow our protocols. So again, appreciative for all of you that are staying connected through this mechanism, through this way of communication. As I started to say earlier, we continue to be challenged, but I do firmly believe that we will get through this difficult time if we remember a few things. The first is, every day we take care of people. We're in the business of caring for others, not only for the folks that we support, but also caring for each other. And when we actively live our values and care for each other, we do everything to keep ourselves, our colleagues, and the people we support safe. And that's where, again, wearing masks, social distancing, washing our hands frequently, wiping down surfaces, and respectfully asking your fellow coworkers to do the same, all continues to be very important. Using our voices to hold each other accountable to these protocols is critical at this time, and a great example of our values in action for our community. So I encourage everyone to use your voice as a member of this community to ensure that we are all following the protocols and continue to follow the protocols that will allow us all to be safe. When we also care for each other, again, that's something that we do every day, we support each other. And in its simplest form, this support can be as simple as listening to one of your colleagues and creating space for your coworker to share or express their feelings. Remembering that we are all enduring the same storm, even if we're on different boats. And as Shana and others have reminded us today, remember that we are only going to reopen programs and administrative spaces and transition back to full operations when we feel like we are able to do so in a way that keeps us all safe and keeps the folks that we support safe. That is, we're going to err on the side of caution as it relates to reopening our spaces and moving back to full operations, because erring on the side of caution is consistent with respecting the dignity and worth of every person. And obviously, as we keep each other safe, we're also keeping the folks, our families, and the other folks that we care about safe every day as well. So cannot stress enough the importance of continuing to follow protocols and using your voice as a member of the community to ensure that we are doing so throughout. The last few months have been exhausting and frustrating, but because of our values and our incredible staff like you, we will get to the other side of this together even better. So I truly thank all of you for attending today. I thank you for all that you're doing every day to keep our folks safe as well as each other safe. And tune in to our next meeting, which is scheduled 2 weeks from now on Monday, July 27th at 12:30. So remain hopeful, remain strong, continue to use your voices to respect, care, and support each other. Thank you all. Have a great afternoon.